Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors, Edward Koch, from 1805 to 1892. Koch's peculiar tumor. Large ulcerated sebaceous cyst of scalp. Edward Koch was born in Tottenham, London, in 1805. His father was an underwriter at No1doctor. In 1821 young Koch was apprenticed to his famous uncle, Sir Astley Cooper, and began his medical studies at the United Hospitals of Guy's and St. Thomas's, which then stood opposite each other on either side of St. Thomas's Street in Southwark. When the two hospitals separated their alliance, he followed Astley Cooper to Guy's, where he was appointed demonstrator in anatomy before he had even qualified. He passed his MRCS in 1828 and was appointed assistant surgeon in 1838, promoted to full surgeon in 1849. He continued on the staff until his retirement in 1871. Koch was always popular with the Guy's students. When they established the Pupils' Physical Society and the medical school in 1836, Koch was elected as the first honorary president, and he continued in this office for the next 40 years. At the Royal College of Surgeons, Koch became one of the first 27 fellows to be appointed when this qualification was established in 1843. He went on to be elected to its council, was an examiner, and then elected president of the college in 1869. He remained a bachelor until the age of 62, when he married a widow. They had no children but lived happily together until her death in 1886. Koch lived for nearly all his professional life a few yards away from the entrance to Guy's in St. Thomas's Street. Among his patients were many of the rogues and thieves who lived in the surrounding slums. They treated him with great respect and never attempted to deceive or molest him. Koch was the first surgeon in this country to remove a set of dentures impacted in the cervical esophagus by means of a lateral pharyngotomy. Koch was particularly interested in urology. He devised the technique of intubating the bulb of the urethra via the perineum in cases of impassable urethral stricture, the knife being guided by a finger in the rectum. This was a great advance on the cruel attempts of forcible blind passage of sounds per urethra. He had a great sense of humor. He would say with a name like Koch, "I was fated to be a urologist." The peculiar tumor recorded by Koch in the Guy's Hospital reports of 1853 refers to an elderly lady who came to his outpatient clinic wearing a curious hat, shaped rather like a large Egyptian fez, and complaining of a lump on her scalp. This had been present for no less than 47 years and was now bleeding from time to time. On removing the hat, an enormous vascular ulcerating and bleeding mass was revealed. However, when this was removed with torrential bleeding, it proved to be a very large ulcerating benign sebaceous cyst. It was a peculiar tumor because it looked so obviously malignant and yet proved to be entirely benign. In his old age, Koch retired to Kingston-on-Thames, where he died in 1892. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fomid.